So secondary, so those were primary problems, and those can cause these secondary problems. One of them is weight loss, and one of the things to consider with the decreased mobility is that the bunny might not be able to get to the food as fast as the other friends who are not disabled. And so sometimes they have to be fed separately or even syringe fed to supplement feed them. The other thing is muscle atrophy. And you can have that with arthritis, paresis, and paralysis. The muscles will shrink because they're not being used. And or if there's decreased nerve conduction to the muscles, they also will shrink down and atrophy. You can a lot of times with older rabbits or disabled rabbits is we experience weight loss. And they're losing weight, but they're eating great, and their poop is great, and their gut is great. They're losing muscle because they're not getting around as much or decreased nerve conduction. And so sometimes it's hard to judge just because the scale is going down and the muscles are going down. If they're happy and they're running around and their gut feels good and their poop looks good, then they're stable. And just like you have, some of those like 100-year-old, great grandma who's, just kind of like skin and bones but doing great, and it's that kind of a thing. Like, yeah, they can be really skinny and have a lot of weight loss, but they can still have a good quality of life. So you can see the upper picture. That is Chewbacca and Zorro, and Zorro is, by the way, for adoption. Chewbacca has since passed away. Chewbacca got hind end weakness, couldn't get to the food, and of course Zorro had no problem eating it up, and you can also see some of the padding that I've got on the edge there to help support Chewbacca. And then the bunny on the bottom, that's Scooty's little butt, and you can see kind of those scrawny little legs, and this is at bath time, this picture. And you can also see the skin is maybe a little bit red, a couple of poops stuck on there I was about to clean off. And then what had also happened to her is because her muscles had just contracted and then her joints were kind of frozen, is her back legs kind of were like squished up together. So you can kind of see that also. And then it makes it really hard to wash in between their back legs. So more secondary problems, urine scald. So if a rabbit is sitting in its urine when they're peeing on themselves, if they don't know they've peed, so they don't know to move out of it, or they can't feel anything, or they can't control their bladder and they're just peeing whenever and leaking urine, then the urine stuck on the skin is going to cause what's called urine scald. It is a burn, basically, and there could be different levels. It could be mild, moderate, obviously, or severe. And a lot of times what will happen is when your rabbit is first starting to have problems, their fur is nice and clean. Maybe there's a little bit of urine on the outside of the fur. That's okay. You clean it off, you monitor, but at a certain point, the urine soaks into the fur, and that's where you get the problems, because then the fur is holding the urine to the skin. And at that point, you want to start shaving them. The bunny here on the left, you can, a lot of that, that's actually not shaved. That's the fur that's kind of fallen off because of the urine scald. That was more a situation of just like sitting in urine and feces, and that is some pretty severe hock sores also, and severe infection, and that I don't remember if that bunny made it or not. So yeah, and that can really cause a lot of problems. So then there's decubital ulcers, and these are pretty gross pictures. I don't know if you can see them very clearly from there, but basically what happens is when there's the tissue that's overlying a bony prominence, is you've got your bone and a little bit of muscle in the skin, and it's just pushing down in constant pressure as they're laying on that. And if you don't have thick padding, or if you have urine on that spot as well, then you're going to get what's called a decubital ulcer, and you're going to get damage to the tissue, and it's just going to get so damaged. First, it starts off with skin and the subcute tissues, and then down into the muscles, and you can have exposure of bone. And so the one on the bottom, this was a big Flemish giant that was really, really sick, and she was laying in her urine, and so it just got covered in just this big bruised red purpley scabbed area, and that area in the middle there, this is an opening in the skin, and that's muscle overlying the bone of her hip. So then the bunny up on the upper left, she had really, really severe arthritis in her hocks, so her right rear leg kind of turned like this, and then so she was basically laying on this part down, and because there wasn't much flesh there, then we were watching it really closely. It was getting red. It did get a little scab, but because the owner was really good about it and was really on top of it, and she brought her in a lot, we were able to prevent it from getting bad. So, but yeah, that it just became a problem because that was her downside, and it just wasn't enough flesh to cover that part. Okay, then another secondary problem we can have is abnormal urination or dysuria. And if you look at the picture that is rabbit bladder sludge. So for those of you who don't know what sludge is, basically it's calcium crystals, buildup of calcium crystals. As you can see by me putting my finger in it, it's like sand. With abnormal urination, we can have rabbits that are too arthritic to get in and out of their litter box. And so usually when people say, the first thing I say to people who tell me that their bunny is no longer using the litter box is, let's cut down the side of the litter box. Okay, and see if, they might be getting a little arthritic and can't jump in and out of the litter box. They can have urine leakage, and what can happen is that there's a sphincter muscle at the urethra. So you have your bladder here, and then you have the sphincter going out to the vulva or the penis. And there's a sphincter of the urethra, and that is going to keep the bacteria from going from the vulva into the urethra and into the bladder, and it also is going to hold the urine in until they're ready to pee. And so there's nerves that are going to go down the spine and sense that the bladder is big, and it'll tell the urethra to release and tell the bladder to contract. Okay, and so if you have a weak urethra from the nerves not working right, that can allow bacteria to go up. Plus also, if you have a bladder that's just sitting there with urine and the crystals and it's causing irritation, then that also can open them up to infection. So the other thing also is you have rabbits that are unable or unwilling to move out of their urine, and so they can just sit there and get urine all over their butt, and so that's another problem that can occur. More abnormal urination issues, neurogenic bladder, and that's what I was talking about with the nerves that go to your to the bladder and to the urethra. If you have compression of those nerves from disc disease or from trauma or even like a blood clot, then you have decreased nerve function to the bladder and the urethra. And so if we so you can have it where the urethra sphincter is too tight and won't release. And then you have this big full bladder that, especially like with Marshmallow over there, you have to overcome that sphincter to get her to pee. And so it can be difficult to get them to release that sphincter and pee. And so what happen is the bladder will get bigger and bigger and bigger and stretched out. You also can, and also if you have where they don't have any control over peeing, then you can have the bladder that just gets more and more full, and you think they're peeing because there's some urine, but what's really happening is the bladder is getting too full, and what you're seeing is overflow. And that's why with these downer bunnies, or a bunny that fractures its back, I need to know, are they really able to use their bladder? Because I've seen a couple of bunnies that had fractured backs that the owner said, yeah, there's urine in the cage. He's peeing. And I felt the bunny, and the bladder was huge, and what was coming out was overflow. Okay, so we definitely always have to make sure that they can empty their bladder. There was one bunny who was having chronic just urine all over him, and it turned out that, he had a fracture way, way down, and his bladder was as big as his belly. I mean, it was humongous. And he just walking around eating, acting totally normally, but the owner didn't know, and she was a really good rabbit owner, but this was new to her. And so we got his bladder. It was so overstretched, we got it down to normal size, and she expresses him, 2 to 3 times a day, and he's been doing great. So let's see. So when we talked about that retaining the urine can contribute to developing infection and buildup of calcium crystals and sludge. Sometimes with these rabbits, the bladder may just be long and thin and just flaccid and just kind of wimpy, and they just can't totally express out enough of it, and it's just the bladder muscle is weak. Let's see, we talked about that we have increased sphincter tone, and so it makes it difficult for them to pee, and also the bacteria that can travel up the urethra.